There is great excitement about data on the utility of glutamatergic agents, in particular ketamine, in the treatment of mood disorders. Two major questions have followed from this recent research, and both of these questions are addressed in an important new study from Feder and colleagues. One question concerns the degree to which medications like ketamine might be important in the treatment of disorders besides major depressive disorder. And Feder and colleagues report new results that suggest that ketamine might also be important in the treatment of post-traumatic stress disorder. The second question concerns how best to use ketamine with repeated dosing. Here too, Feder and colleagues also provide important new data. They compare repeated exposure to ketamine infusions with repeated exposure to midazolam control infusions, and again, suggest that such repeated exposures to ketamine might be efficacious in the treatment of PTSD. This should increase interest both among clinicians and researchers about how ketamine might eventually be incorporated into psychiatric practice. As research accumulates using brain imaging to examine a range of mental disorders, major questions have arisen about specificity. These questions concern the degree to which perturbations in brain structure relate to particular disorders on the one hand versus any manifestation of psychopathology on the other. And Romer and colleagues report important new data on brain structure that supports this second idea. That second idea is that perturbations in brain structure, in this instance, the overall thickness of the cerebral cortex, show a stronger relationship with general manifestations of psychopathology as opposed to more specific manifestations. These findings are important because they cast new light on thinking about what are the features that are shared across mental disorders and how these differ from one or another feature that's found only in subsets of patients with mental disorders.